I don't know yet, but
Hello and welcome to Reach Live. It's how is it November already? So time is flying by. It's one of our penultimate Reach Live sessions for this year. So thank you for being with us. I'm Rena Such. I'm the head of digital and connected health at Ipsos. Ipsos are a global market research and insight agency, and we run data. We run data in healthcare. And since 2014, I've been tracking and trending the trends of this market, and it's changed incredibly. And today, the topic is changing times and changing focus. Over the years, we've seen digital health investment and funding and acquisition action just rise year upon year. This year is the first time we've seen a dip. Doesn't mean that things are going to slow down, but it does mean there's more pause. To discuss this and more, I have a brand new Reach Live guest who's with me today. Stan, hi, welcome.
Hi, Rena. Thanks for having me.
Great to have you. To kick us off, Stan, give us an introduction. Tell us about you, your background, what brought you into healthcare.
I appreciate that. And, the background I have is I'm the director of the digital health program at Columbia Business School that offers numerous different courses in healthcare, digital health, healthcare transformation, digital transformation in healthcare, and have been doing that for about 5 years. It's really the more sophisticated digital health training program out there, certification wise, and one of the top MBA programs globally, and one of the top healthcare MBA programs globally as well. And have been working very hard over the last 30 years and teaching and research around the efficacy of digital technologies in healthcare and medicine. And that work has included things like doing studies in Africa, Asia, Latin America, Europe, and certainly North America, and have been involved in hundreds of these studies, leading them as a principal investigator, and then also teaching as well. I've been teaching at Columbia since 1996 and have been a visiting professor at the Indian Institute of Technology in New Delhi, India since 2006. So I'm really glad to be here and excited to share whatever knowledge I have with you and your audience.
Great to have you. It's quite a CV. So, what led Columbia to start this program 5 years ago?
It was the recognition that digital health was an emerging and growing field, and the demand from its executives and its graduate students that there was a need for more understanding about how digital could be used in healthcare and medicine and life sciences. And so, really, that kicked it off, working with the executive education team in the dean's office. And then the pandemic exploded and really brought the need for digital transformation for organizations, life science companies, et cetera, national health systems to the front of the front page of all headlines around the world. And so patient care, patient research, and the need to be able to deliver healthcare virtually and digitally became not something that was nice to have, but something that was urgently needed in order to maintain the healthcare standards that we'd established over the previous 100 years. And so it really did see a massive extrapolation. And I think you mentioned it already starting. We saw the funding levels rising with that as well. And so that's why one of the programs we have at Columbia is around investment and financing digital health startups. And it's been a very popular program. And it's something that now, as you mentioned earlier, with the funding sources changing, those dynamics are changing. And so is what we're seeing in the ecosystem.
Mm. And what kind of profile of individuals are you seeing signing up to do this course? It's an MBA, right? Is it kind of, is it a section, is it a module within? Or, I mean, give me a bit more of a sense of what are your profile of your individuals that join?
Great question. So first of all, it's a certification program, so anyone can enroll anywhere in the world. It's done virtually, so it's very easy for people to enroll at, again, the Columbia Business School website, Executive Education, and it's very easy to join and to have and acquire not just the knowledge, but the network and the inspiration. Being able to attend all of these different certifications online and live online, which is nice because it's a real-time interaction. But
Mm.
yet, if you're not near New York City, it's very easy to attend and engage in these with these executives all over the world. And to answer your question around who is attending and who's enrolling, we have board members from Kaiser Healthcare in the United States to people who are working with the World Bank in Africa, Asia, Latin America, to executives in Europe and North America, Latin America, Asia, Africa. It really is a nice mix. A lot of folks coming in from the Middle East and South Asia as well. They're offered from 11 a.m. to 2 p.m. Eastern, Tuesday, Wednesdays, and Thursdays. So it allows folks almost all over the world to attend because it's somewhat within their realm. I have to say it's really impressive to see executives from Dubai and New Delhi and Mumbai joining in when it's 11 p.m. their time. So some executives are very committed to these programs, and it's nice to see their engagement and their feedback is incredible, and it really does help inspire the executives that are all over the world that are attending these.
From your perspective and from what you've seen, how the digital health space is changing, what have been some of the things that you've kind of learnt along as the curriculum's been built, as the course is being built? What's been your kind of key learnings over this time so far in digital health?
Well, it's really quite interesting because we're doing a lot of research at Columbia as well. So whether it's folks who are working at the School of Business in so many different areas, operations research and artificial intelligence and machine learning and medical economics and the economics of medical technology innovation, we have some of the leading researchers and publishers and authors of works that are coming out in digital health and coming out in healthcare to start with. And then when you look at other parts of Columbia University, whether it's the School of Engineering or whether it's the Department of Biomedical Informatics and the medical school and the nursing school, you see this nice convergence of scholarship occurring across platform as the university has over 60,000 faculty, staff, students, researchers, administrators, etc. So it's a massive community with 5 campuses from Broadway, Morningside Heights to Manhattanville to Washington Heights to the very northern tip of Manhattan and where the athletic fields are and some of the other medical centers are, all the way up into the Earth Institute in Rockland County. So this community is dedicated toward the greater good, dedicated toward improving healthcare, medicine, life sciences through digital. The changes have been extraordinary. We've seen in the course of roughly 3 years of pandemic, about 10 to 15 years of accelerated change of digital transformation in healthcare and life sciences. It's been amazing. As someone like myself who's been in the field for 30 years, teaching, researching, publishing in this area, what we've seen is truly unprecedented. And if you look at the development of medical technology over the last 100 years, really going back into post-World War II and the development of the polio vaccine, the absolutely incredible work that public health professionals, physicians, national health systems did to eradicate smallpox through the 1960s and 70s until 1979, when the World Health Organization and the United Nations certified smallpox as eradicated, as the first and only disease to be eradicated. The development of medical technology, and certainly digital as an adjunct of one of those components of medical technology, has been extraordinary in the last 3 years. I mean, not to mention the most important piece, which is having many vaccines available and developed in such a short period of time, less than a year, but also the actual uh, supply chain efforts to deliver those vaccines and implement those vaccines across the world to billions of patients. That's stunning from a medical technology perspective. And so digital and what we're teaching and what we're finding in our research, and really the conversations that these digital health certifications and these courses offer, these conversations illustrate just how difficult it is from a cultural standpoint to transform an organization, from a political standpoint to transform an organization. And again, the School of Business at Columbia, really anchored by Nobel Prize winning faculty and professors in this area, is around the economics of it. Because if the economics don't work out, whether you're a national health system or whether you're the Gates Foundation, it doesn't scale and it's unsustainable. So there needs to be a sound foundation of economic sustainability to whatever is happening. And so digital is undergoing these growth pains as much as everything else. And so it's really been these changes in remote patient monitoring, in artificial intelligence, in virtual machines, digital therapeutics, decentralized clinical trials, electronic health records, telemedicine. So there have been several vectors within what I usually measure digital health in 12 different vectors. There have been several of them that have been accelerated through national health funding, through venture capital investment, through a lot of private equity moves we've seen now over the last year, since the venture capital market has started to become a little bit more rigorous and more difficult to obtain funding in. And so we've seen now the massive changes taking place in those areas, and the massive adoption that's been needed to actually acquire those technologies and then implement them with patient populations. And now, with the pandemic subsiding, by no means over, but certainly in an endemic stage, we're now seeing, the tree bent as the winds of the pandemic hit the healthcare system, and the tree bent and it went far over to the digital side, and now it's come back more to central line to where it was in 2019, although not completely. But the need for a virtual infrastructure and the economic benefit to that, and the overall benefit to that, to improve patient outcomes, has been demonstrated. And so we're seeing now this national infrastructure, international infrastructure, and what Glenn Tolman of Transcarent Healthcare has mentioned in one of my classes. Glenn and his partner Lee Shapiro had started Livongo in 2013 and sold it to Teladoc in 2021, and for $18.5 billion, the biggest multiple, I guess it's the second biggest multiple of any Silicon Valley company sold ever. And what he said after, again, taking his funding from that and starting Transcarent, which is really a digital healthcare company to provide healthcare to patients in the U.S. using largely virtual and other technologies, is that we are building now, right now, the United States is building a digital infrastructure for healthcare that will take about 10 years to complete. And so we're just seeing the beginning of that. And so think about managed care in the United States in 1990, it was almost non-existent. By 1999, by 2000, managed care was almost the only healthcare that you could find as a patient in the United States. We're seeing similar adoption rates occur in digital, so that by 2033, we're anticipating that the majority of healthcare transactions will be completed virtually, and you will use digital technologies to do that. And so we're anticipating, because of the economic benefits, the improved customer service benefits, that this digital transformation, it's a revolution in the sense of a 10 or 20-year process that really did start with the dot-com phase and has taken a lot longer than people had expected. But the pandemic has infused so much funding now and reset expectations with patients that it has changed. And the courses and the certifications that we offer at Columbia Business School reflect that. And that's a big part of what we're seeing the demand for as well in the ecosystem.
That was like so much insight in such a short period of time, and such clarity. So thank you. I mean, I had questions around the prediction of when it will happen, and you've really given it a 10-year estimate based on really sensible commentary, really, because you're right. And I love the analogy of the tree bending and now coming back, but us knowing that we have to go back, we have to find a better way, not just be forced, but find a better way to maintain this. Who are going to be the critical influencers of that? Business, business want it, individuals want this to happen. Like you say, the consumer, the patient is being empowered and seeing, oh, I can do things like that. Wow. Therefore, they're wanting for it. Healthcare professionals that we survey often say, I'm too overwhelmed. Like, just give me a minute to breathe. I don't know what this new thing is, but I haven't got time to even understand it. And then you have implementation, all that. So talk to me a little bit about who will be the levers of change here. Who are we going to influence to make it happen?
Well, certainly the patients are the most important, and they drive the change in the system. And the term patient-centric and patient centricity is so important to understand, and that they are going to lead the charge. Their expectations have been reset. So patients now are subscribing to services. They're paying monthly subscription fees. We're now living in a subscription society. So whether it's your groceries or whether it's your Netflix or whether it's something else, you're subscribing to things, your Apple Music. It's an incredible society now where we subscribe to things that we really do need the most. And that's the number one thing is that patients now, not all the patients, by the way, to be empathetic, it's clear that we have to understand that there are a lot of patients who are not, either they don't have access to the digital technologies or they don't have the socio-technical background to access the digital technologies. So digital is not for everybody, but what we are seeing is it's now in demand more than it's ever been. So patients will drive this change. And physicians and providers, nurses, physical therapists, speech therapists, occupational therapists, they're going to be the folks that are going to support that. They have seen now what digital can do and what it can't do, by the way. So we have to keep in mind, again, being empathetic. And again, I've been at Columbia Medical Center since 1996. I can tell you that clinicians in general around the world don't really appreciate having to type in patient notes, and that most of the electronic health record systems, whether in the US, Canada, even China and India, and certainly Europe, are based in code that's either second or third generation programming languages, which are not friendly for swiping, not friendly for voice to text. And so there's a massive amount of disruption awaiting the electronic health record system around the world because these systems are just incapable of being able to adapt to a much friendlier user interface. And so physicians and clinicians are still using these technologies as much as they can to help provide the best service possible and to help ensure consistent notes and consistent charting across medical records, lab records, prescription records, and radiological records. So that is happening. And they're another key element to supporting this. But keep in mind, this is very important, Rena. These folks have been substantially stressed during the pandemic. So there's not very many people that can say they go to work every day and their lives are being threatened. So that by going to work and potentially catching a fatal virus, that's very unusual. And we've not ever seen that before in the physician community, at least not for over 100 years in the Spanish flu pandemic from 1919. So physicians now are heavily stressed. There's a staffing shortage for physicians and clinicians around the world. And so there's a need there, but they will still support as much as they can these new technologies. As stressed as they are already doing that. And we're seeing that just the research that I do at Columbia, our partners, we have research partners all over the world, but even, particularly places like Downstate Medical Center and Downstate Medical School in Brooklyn, New York. We see a lot of these physicians, even though they're working 60, 70, 80 hours a week, their nurses, their clinical staff, they are willing to try new technologies, and they want to find something that can make the entire patient process better and improved outcomes, reduced friction, et cetera. So that's the other element, providers. And then the third element are the payers. And this is very important. And if you have a chance to really think about why did managed care move from roughly 2% of American healthcare in 1990 to roughly 95% of American healthcare reimbursement and infrastructure in 2000, it was the payers. So the governmental health systems, the large employers, self-insured employers particularly, saw that there were new ways to provide healthcare services, healthcare delivery that were more efficient economically. And they didn't just walk to that model, they ran to it. And so as we see these new models develop that are using digital underpinnings and virtual underpinnings, we're going to see a substantial number of payers moving to that model. Again, like I said earlier, especially if you listen to anything that Glenn Tolman has talked about or read any of his books and his articles, you'll see he really understands this. He gets this from an ecosystem level, and he's done this before. He's on his fourth unicorn. Glenn started companies going back to the late 1980s and been able to bring tremendous value to the healthcare system around the U.S. And so I think we're seeing that now. And so those are the forces that you're talking about, those three forces: the patients, the providers, and the payers that are going to bring this together. Not alone. We have to remember there's also the entrepreneurs, the innovators, and we're very lucky in this country to have a really an incredible ecosystem and energy of entrepreneurialism in the United States. And if you everything from looking at the different challenges, like for instance, I'm working with AARP right now to run an innovation challenge for age tech. There are challenges every day that you read about in different fields and different parts of medicine and healthcare. These challenges inspire entrepreneurs to be the next innovator, to be the next one to maybe disrupt the electronic health record market or whatever might come next. And so that's important. And then finally, this appetite for risk. And the US has always led that appetite for risk taking, whether it's technology spend, where US companies spend much more on digital technologies than any other continent on the planet. We are known for having that appetite for risk, where we'll spend a little bit more on R&D, on innovation, on new ideas, because there's a hope that that will give our organizations a competitive advantage. And so this country is really built around that. And the venture capital community, the private equity community, the investor community, and frankly, the angel community, being as lucky as we are to live in a country with so much high net worth individuals, so many high net worth individuals who have the ability to put down 25,000 or 100,000 or 250,000 on a digital health startup. That's unusual. And having worked as much as I have in Africa, Asia, Latin America, and even Europe, where the appetite for risk, especially risk at that level, isn't quite as high. Although I've been to India a lot over my last 20 years, there's a lot of appetite for risk there. There's a lot of entrepreneurialism in India as well, and frankly, all over the world. But here in the US, we can support it with funding and with technologies and ecosystems that don't necessarily exist all over the world. So it's that funding community and those elements of entrepreneurialism that really do support what we're going to see as a massive digital transformation over the next 8 to 10 years.
Lots to take in, to be quite frank, Stan. I mean, I think it's been fantastic to learn so much more. How can people find out more? Find out more about the work that Columbia are doing, how to get information about the course and anything upcoming events that you have. Tell us, how do we find out more?
Well, certainly, as an academic, my mission in life is to help support people who are trying to do this. So reach out to me on LinkedIn. Again, feel free to just link in with me and connect with me on LinkedIn. Happy to help people out and point people in the right direction. There are amazing resources for entrepreneurs, for physicians, for clinicians, for patients to go online and look for different funding sources, look for different support services, whether you're in New York City or Boston or Washington, D.C. or Atlanta or Miami or Austin or San Diego or San Francisco or Seattle or Chicago, Kansas City, Nashville. I mean, there are innovation ecosystems in healthcare and medicine now that didn't exist, certainly when I came into this field in the 1990s, and have been substantially growing each year as we've seen the successes of these ecosystems bring to bear new companies and new technologies. Like, even look at like New York City, WebMD, based out of New York City, Medidata, the clinical trials company that supports 70% of the clinical trials around the world through their software, New York City. J Labs, New York City. If you continue to look at 3 of the top 25 medical schools, Cornell, Columbia, NYU in New York City. So there's an extraordinary ecosystem there in New York. You have Boston's phenomenal ecosystem there as well. Certainly Washington, D.C., Chicago, Toronto, if you're in Canada. I mean, in North America, we have a number of ecosystems that, because of this alignment and this convergence of academia, of venture capital, of med tech. Life science is very important too, and certainly in places like LA, New York, San Francisco, and Seattle, and other places, you have media, and certainly Madison Avenue in New York City plays a huge role in helping support that community. So the best place to start is to go online and just start doing searches for these types of digital health supports, digital health incubators, digital health accelerators. Just put in digital health in your local area to see what resources are in that area, and use Google Maps, use Google videos and Google Images. You'll find that using not just straight web search, but a number of other of the search tools that sit in Google, you can find a lot of that. And I would even recommend just tagging whatever you're tagging on Google with and putting LinkedIn at the end of it. A lot of times you can go into LinkedIn and see enormous amounts of resources sitting locally right nearby you, and use whatever kinds of social media that you like to use, whether it's Twitter, Facebook, LinkedIn, Instagram, and try to connect with people that way. The ability to connect virtually is much better than it's ever been before as well.
Absolutely. We heard from Stan. Get with him on LinkedIn, ask him any questions you have. Check out the program at Columbia. And thank you so much. Thank you for spending your time with us, for sharing your insights. That 10-year piece is staying with me. It makes so much sense that the infrastructure that we've built and how much our expectations have changed means we are leaning towards a really new way of delivery of healthcare. But it's not going to happen overnight, and everyone has to play a role. And let's hope those listening will play a significant role in that too. So thank you so much, Stan. Everyone else, thank you for joining Reach Live. Don't forget to subscribe the YouTube channel, join everyone on LinkedIn as well, and keep engaged with us in the content that was shared. Thank you.